Hello, my name is Donald Richardson, and I work for Professor Amy Cohn here at the University of Michigan in the Department of Industrial and Operations Engineering. Today, I just wanted to talk to you about my work at the University of Michigan Comprehensive Cancer Center, and we're looking at determining an optimal schedule for premixing chemotherapy drugs. So I start off just process flow. Typically, when a patient comes to infusion, they go to blood draw infusion, and then they go ahead and get their blood taken, move on to clinic, or then move on to infusion. And before their drug is actually made, the pharmacy needs to make sure that their vitals and everything are on par or up to the standards so they can actually receive treatment for that day. And with that, though, it causes the patient to have to, at minimum, wait at least the time it takes for the pharmacy to mix the drugs because they're not considering mixing these drugs ahead of time. What I'm looking at is, what if we decide to go ahead and mix some of these drugs ahead of time for these patients? Well, what does that entail? I mean, yes, we'll have the drug ready so the patient doesn't have to wait the 30 minutes to an hour for the drug to be made. However, there are waste costs involved. So if the patient doesn't show up, then there's a possibility that you just actually wasted drugs, which vary in cost from $2 all the way up to $6,000. So that's a very important issue. But then I asked the question, what if we have 5 patients scheduled to receive the drug any given day? Or what if the probability of this patient not showing up is extremely low? So this is what my model is basically looking at. It's considering these probabilities of wasting drugs, considering how many patients are scheduled to receive a particular drug any given day, and then coming up with some optimal decision to say, let's go ahead, mix drugs XYZ, the 1 dose or 2 dose of these drugs in order to minimize this expected waste cost.